Where am I at? Okay. Hey, this is Tara Ensor. I'm with my daughter Lily and Jordan. We're going to do some inspections of abdominal, musculoskeletal, and neurological for checkoff number 3. So first thing I am going to do is check on abdomen. How has your appetite been?
Fine.
Do you have any trouble swallowing?
No.
Do you have any foods that you can't eat?
No.
Have you had any abdominal pain?
No.
How about cramping?
No.
Have you had pain with your periods?
Yes.
Does it get better with Tylenol or ibuprofen?
Not really.
Okay. Any nausea or vomiting?
No.
How often do you poop?
Like 6 times a day.
Is that normal for you?
Yes.
Is it brown?
Yeah, sometimes.
Okay. Have you ever had any trouble with ulcers or gallbladder disease? Are you taking any medications?
No.
All right, can you lay down on your back for me? All right, then I'm just going to take a look at her belly. And looking at her belly sideways like this, I can see that it's mostly flat across like here. And I'm going to look down on it and touch, and it's symmetrical. It's normal for her age. The skin is intact, pink throughout. There's no lesions or scars. Her umbilicus is midline and inverted. I don't see any redness or swelling or irritation there. She doesn't really have her hair on her belly. There's no hair distribution whatsoever, which is normal for a girl. I might see just the very slightest little bit of pulsation right here at her aorta. She's pretty thin. Just a tiny bit. It's hard to see over her breathing. She's a little bit bad mood today, but she's relaxed. I'm going to take a listen to her bowel sounds in all 4 quadrants. Her bowel sounds are normal active. I don't hear any extra sounds. I did hear them in every single quadrant as well. All right, I'm going to listen to any vascular sounds. Let's start in the middle. For the aorta and the left renal, should be over here. Right renal. Iliac. Right iliac. Left femoral. Right femoral. I don't really detect any sounds at all, no bruits or abnormal sounds. Nothing abnormal going on there. I'm going to just kind of take a listen through tympani at her stomach all around the quadrants. All the sounds are appropriate. I just hear mostly tympani over her intestines, a little bit more dullness when I came over her liver. I'm going to measure her liver span. That one was pretty easy to hear. You could hear hers real easy. Hers is about right there to right there. Then I'm going to take my ruler, wherever it went to. Where's my ruler? Here it is. Does it? Oh, it's still going. Okay, well, alright, lay back down. So I'm going to take my ruler and, well, those marks really got good. I'm going to mark the space between. Hers is right at 7 centimeters, which is within normal range for a liver, especially for a small female. I'm going to try to find her spleen, which is over here. Relax. Her spleen is right here. I can feel it, and I can also see it just ever so slightly. She's had mono a couple times in her life, so her spleen is just a smidge big. Also, if you'll sit up on your butt and face the wall. And then we're going to do her costovertebral angle tenderness, basically to check her kidneys for tenderness. Does it hurt?
No, it just feels weird.
Okay, it just feels weird. So her kidneys are normal and healthy. Feels weird is a normal thing. All right, lay back down again on your back. Let's give you some. All right, and then we're going to do the fluid test to test for ascites. Put my hand midline and smack her. Nothing. And smack. Nope. Virtually no movement in her abdomen at all. So no ascites present. Then I'm going to just have you bend your knees just a little bit so your feet are touching the bed. All right, and then I want to just palpate with my forefingers in all of the areas. I don't really feel any abnormalities. She is a little bit guarded, which is a normal finding, and her spleen is a little bit distinctive too. But like I said, she's had some illness there recently. And deep palpation. Also, she's just a little guarded, but I don't feel any abnormalities. Liver is really easy to find. Hers is all right here. Hers was easy to hear as well because she's so thin and it's not enlarged. Spleen is all good. And the kidneys, if she weren't so ticklish, would be easier. Is there any tenderness or anything there? Alright, no tenderness. And I really can't distinguish her kidneys there. I don't feel any abnormal bulges or anything. She doesn't have any tenderness whatsoever. And her aorta, we could see it when she was not so guarded right here, just barely pulsating. But I'm not able to distinguish it with palpation, even though I can kind of see a little fluctuation when you're down low at her level. Okay, now we're gonna do musculoskeletal. So I'm just gonna ask her a few questions. Are you having any trouble with any joints?
No.
Do you have any stiffness in your joints?
No.
Any swelling or redness in your joint?
No.
Any limitation of movement in your joint?
No.
Do you have any pain or cramping in your muscles?
No.
Are your muscles feel weak?
No.
Do you have any bone pain?
No.
Have you had any accidents or trauma to your bones? Have you broken a bone before?
Yeah.
Where at?
My thumb.
She broke her thumb. That stinks. She did it. How'd you do it?
Softball.
Softball. Do you have any trouble with your muscles or bones that prevents you from bathing, dressing, eating, taking care of yourself in your daily life?
No.
No, that's good. All right. So first thing we want to do is check her temporomandibular joint. So move your hair back. All right. Open your mouth. Oh, open. Close. Put your chin forward and back. Try to push it forward. And side to side. Alright, I don't really feel any popping or cracking. Did you have any uncomfortable sensations there?
No.
Alright, she thought it was a little weird, but it wasn't uncomfortable. So her temporomandibular joint appears to be intact. The skin all around it appears to be within limits. Oh, hey. Okay, so here we go. All right, so the joints are equal in size. There's nothing bulging or anything. The skin is normal. She demonstrated all the range of motion. She did flexion, abduction, adduction, abduction. What did I miss? Flexion, adduction, abduction. So good normal range of movement. And so that one's that one. All right, the cervical spine. So if you will, take your head and tilt it forward down to your and back as far as you can, and over to the left as far as you can, and all the way to the right as far as you can, and then just turn this way. All right, and that way. Any pain?
No.
All right. Any stiffness or uncomfortable sensations?
No.
So we got all the range of motion in there. There was no popping or cracking. Okay. All right. Now we're going to do shoulders. Can you stand up? Let's make sure this is where it needs to be. Oh, hi again. Okay, shoulders. So can you put your hands behind your back like this and press out? Press out. Good. All right. And let go. All right, now cross your arms across your back like this. Very good. Any pain in there?
No.
And I move them again down. All right, no crepitus either. So that's good. No abnormal findings yet. All right, can you put your hands up above your head and clap your hands? Any pain or discomfort?
No.
All right, you can stop clapping. All right, now put your hands behind your head. Oh, okay, go up and do it again. All right, behind your head. All right. All right. No pain or sensations there that are unpleasant?
No.
All right. So she has good range of motion there. The skin in her shoulders is all intact, equal, symmetrical. Hang on, I gotta get. Okay. All right. Now we want to turn around and sit on the bed again. All right, let me look at your elbows. I'm going to look at them. Range of motion. Skin's intact. She has a few freckles there. No crepitus. We'll do this one. Flexion, extension, abduction, adduction. Everything's good. No pain, right?
No.
No sensations that are unpleasant?
No.
All right, so that's her elbows. Now I want to take your hands, your wrists, bend them in, stick them out. All right. And then I want you to make a fist. All right, pull, pull, awesome, and pull. Very good, good, strong. I don't think I could have pulled that back. All right, now we're going to look at her hands and her wrists. I'm going to feel all of her hand, the back and the plantar portion. Look at each finger. We're going to move them, bend them, move them, bend them, move them, bend them. All right. Look at her hands. No soreness, no tenders.
No.
I don't see any sign of any joint disease here. Bend, move, bend and wiggle, bend and wiggle. All right, her fingers are all normal. All right, now I want you to take your hands and put them out flat and bend your fingers down like this. All right, now put your hands up like this. Spread your fingers. Make a fist. Give me 4. Awesome. So her hands also have full range of motion in them. All right, now I want you to just lay your hand down, and I'm going to try to pull your fingers back. Pull. Very good. And pull. Good. All right, good strong arms and wrists. Lastly, I want you to take your hands and pray upside down. Any soreness?
No.
Okay. And then lay your hands back down again. All right. Does that feel weird at all?
Yeah.
Okay. All right. So that was the Tinel sign at the location of the medial nerve. She just says it feels a little weird. And the Phelan test, we did that with upside down prayer. That she also did well on that. Okay, lay back down on your back. All right, bring your legs straight up, straight in the air.
Oh, don't.
And straight up in the air. All right, very good. And up again like this. Up again like this. And open them and close them. Any popping?
Yeah, you pop my hip.
I popped her hip, but does it normally pop when you do that?
Sure.
Oh, goodness. Okay, so a little popping. Does that bother you or create any distraction in your day-to-day activities? No. Okay. All right, and then bend your knee up again. Drop it to the side. All right, and straight back out. All right, and up, and drop it in, and down again. Very good. She's got full range of motion in those hips. All right, now last thing, get up here. We're going to look at your knees. I'm going to kick. Whoop, that one pops a lot. All right, kick. No popping there. I don't see any tenderness or swelling in her knees here. No accumulation of fluid on either side or down below. Oh, she's got a good reflex there on that one. All right. No accumulation of fluid on that one either. Scoot back and make your legs straight on the bed. And I'm just going to look at her kneecaps. No fluids. I could feel that there. And I'm going to also touch right on the tops. Her knees are good. Although I can see that her legs a little misaligned on both sides there. And then straighten out again. Let me come back out again. All right, kick. Kick. Oop, that one has a little pop there, a little crepitus on the outer portion. All right, and then stand up right here in front of me. And then kick your leg up behind you. Behind you. Okay, and the other one? All right, they're very good. Any pain or discomfort there?
No.
All right, then sit back up one more time. All right, scoot on back. Let's look at your ankles and your feet. We'll do flexion, 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 extension, adduction, abduction. Same on this side. Full range of motion on her feet. And I'm feeling her little toes. All right, they've got all good range of motion there. And then I want you to turn your feet in like this and turn them out like that. Point them. Point them. Awesome. Very good. Now we're going to look at her spine. So stand up here in front of me. Turn around. We're going to feel her spine here and feel that it's midline. And it is. I could feel it. I don't feel anything poking out abnormally or any abnormal curvature or side to side. I don't see any scoliosis from that angle. Now I'm going to have you bend over and touch your toes. I'm going to look at her back. And it appears to be straight. So no sign of scoliosis there. Stand up. All right, now I'll turn this way. All right, now go to your side like you're doing a side bend. And side bend to the other side. Okay, all right, and stand up straight and twist. And twist. Any pain or discomfort?
No.
All right, then let's see. Let's get this here. Oh my gosh, it hasn't been. Oh gosh, here we go. All right, now we're going to look her over for her neurological system to check for, make sure it's intact. So, do you ever have headaches?
Yes.
Are they very frequent?
Kinda.
Do you take Tylenol for them?
No.
Do you take anything for them?
No.
Are they bothering your day-to-day life?
No.
Do you have lights flashing or any fuzzy feelings when you have them?
No.
Okay. Have you ever had a head injury?
I don't know.
Do you have dizziness?
No.
Seizures?
No.
Do you have a tremor?
No.
Do you feel like you have weakness?
No.
Do you feel discoordinated?
No.
Do you have trouble swallowing?
No.
Do you have numbness or tingling?
No.
Have you ever had a stroke?
No.
Spinal injury?
No.
Meningitis?
I don't know.
Are you an alcoholic?
No.
Okay. So one of the very first things we want to do is check for cranial nerve 2, the optic nerve. So we're going to check that using confrontation. So open your eyes. All right, so those are definitely equal. She's getting good confrontation on both sides of her eyes. All right, now cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens nerves. We're going to look at her eyes doing the cardinal. So check. Oh, look here. All right, those cranial nerves appear intact. No nystagmus is present on either side. All right, cranial nerve 5, the trigeminal nerve. I'm going to feel your cheeks. So I clench your teeth down. And I'm going to try to pull her chin. And I'm not able to. Relax. All right, and then I'm going to check her sensory function. Close your eyes. Tell me which side you feel.
No.
Right or left?
Right.
I think she definitely felt it. She jumped out of her britches. Close your eyes.
Left.
Okay. Cranial nerve 5 appears to be intact. We're not going to check her corneal reflex. She doesn't have any hearing loss. Cranial nerve 7, the facial nerve. We're going to have you smile and frown. All right. She's laughing instead of frowning. Frown. Show me your teeth. All right. All right. No asymmetry, and both sides are no slouching. And then I want you to blow out your cheeks. And I heard a little air come out, so that's good. That means that cranial nerve 7 is intact. We're going to do cranial nerve 8, acoustic. She's been responding to everything we've been saying today, and appears to be participating. So we're going to say that one's intact. Cranial nerve 9 and 10, glossopharyngeal and vagus. So we're going to look at her tongue. I'm going to have her say ah. All right. we're going to say the gag reflex is also intact. She did not enjoy that at all. I can see that the uvula and the soft palate, the uvula was in line, midline, and the soft palate was intact. Cranial nerve 11, spinal accessory nerve. All right, push your face against my hand. Push your whole face, not your body, your face. All right, and push your face again. All right, and shrug your shoulders. Shrug.
Oh.
Again. All right. 11 is intact, and 12, we're gonna look at her tongue. Stick it out. All right, it's midline. It's normal color. It's moist. It's pink. Both sides are equal. All right. Now we just did all of her musculoskeletal inspection. Those were all equal throughout without any abnormalities. So we're going to check her gait. If you'll just walk to that table and back. Whoop, off screen. Come on back. Her gait was steady and intact. There was no weeble wobble going on, no dragging or stuttering steps. All right, and then we'll have you walk a few steps with your feet in line like this. That's heel to toe. All right, and come on back. And she was able to keep her toes in line. She'd put her toes like this, heel to toe, heel to toe. And you can walk on your toes a few steps. And come on back. And walk on your heels a few steps and come on back on your heels. All right. That's on her toes and on her heels. And she was able to do it, maintain her balance, and keep steady. All right, we are going to check her Romberg test. So stand up nice and straight. Put your hands straight down to your sides. Close your eyes. And we're just going to watch you. We're going to watch her for about, 10 or 20 seconds. Keep your eyes closed. It's cheating. She's got the hiccups. That's kind of throwing her off. All right, just a smidge of a sway, but she's able to compensate. She's not falling over or anything. So okay, open your eyes. Romberg test is good. All right, now bend your one knee and hop on one leg. Hop. And do the other side. Hop. Hop. All right, a little bit off balance, but still within normal range. She's able to keep herself upright. She doesn't fall over or anything like that. All right, now I want you to sit on the edge of the bed. Put your hands like this on your knees. Now turn them over. Now put them back. Now turn them over, back, over, back, over, back. Keep going. Back, over, back, over, back, over. All right, that's going to be the rapid alternating movement test, and she did pass that. All right, now I want you to touch my finger with your finger. Now touch your nose. Touch my finger. Touch your nose. Touch my finger. Touch your nose. All right. Now let's do your other hand. Finger.
Oh my
God. She's able to do it. Her aim might be off just a smidgen, but because she was trying to go too fast, I think. But she did it pretty good. All right. Now can you put your fingers out to your sides? Touch your nose one at a time. Left side. All right. She's able to find her nose every single time, so that's awesome. Her finger test and her finger to nose test, she does pass that. All right, lay it on your back. Put your legs out straight. All right, scoot back some. Okay, I want you to bend your knee, touch your heel to your knee, and run it down the front of your leg. All right, run it down the front of your leg and then bring it back up. Do it again. All right. You'd make a good cricket. All right. Do the other one, or is it a grasshopper? Cricket. All right. She's got all that going. The heel to shin test she passed. All right. So we're gonna have her sit up. Oh, yep. Alright, close your eyes. Now tell me which side you feel this on.
Right. Right. Left. Left. Right. Left. Right. Left. Right. Left. Right. Left.
Does one side feel sharper than the other?
Yeah.
Which side?
Right.
Really?
Yeah.
Which side feels sharper?
Left.
Which side feels sharper?
Can you do it again? Right.
Or do they feel the same?
No, right. Is that not right?
I might need to take my daughter to the doctor. She says it feels sharper on the right than the left. That's not
There's nothing wrong with me.
normal. Alright, we're gonna. Alright, so close your eyes. Where am I touching?
Like shin on the right. Right. Left. Left. Right. Left.
Okay. She passed the light touch test as well with the cotton ball. Alright, I need to have you tell me what I'm doing.
Lifting up my middle finger.
Where at? Right or left?
Right.
Alright, what am I doing over?
Lifting up my middle finger on the left.
Alright. So she passed the kinesthetic test. She knows what I'm doing with her eyes closed. Alright, while you still have your eyes closed, why don't you go ahead and sit up for me? And sit up. Close your eyes. I'm going to put something in your hand. You tell me what it is.
Pencil.
Very good. She got the tactile discrimination fine touch test done. Or using the stereognosis, that's recognizing a foreign object with her eyes closed. Alright, now I'm going to close your eyes. Tell me what I'm doing. What number I'm drawing.
6.
Tell me what number I'm drawing.
8.
Very good. So she passes the graphesthesia test. Now I'm going to have her, we're going to try to do the 2-point discrimination test. I'm going to have you close your eyes and I'm going to poke you and I'm going to have you tell me when they feel like they're in the same spot. Yes or no?
No. No.
Yes or no?
No.
Yes or no?
Maybe, yeah.
Okay, so we could take our little ruler here. She said yes at about 3 centimeters, which is within normal range. Close your eyes again. We'll do it on the other side.
No. Yes.
Yes, they're in the same spot?
Yeah.
Okay. Well, you want to try that again?
Okay.
Yep.
No. No. This is hard. Yes. Ouch.
Okay. So, again, we'll take it and we'll measure it. She was about 2.5 centimeters before she said yes. It feels like it's in the same spot that time. Again, and then she didn't demonstrate any extinction during any of the tests. She was able to have sensation on both sides when I touched her with a cotton ball and the pinprick in her face. Alright, so we're going to check your reflexes now. We're going to check your bicep reflex. Just relax. Alright. 2 plus bicep reflex. We're going to check her elbow. Alright, make your elbow like the scarecrow. Make it dead. All right. Oh, that's a 2+. All right. Oh, got that one too. All right, good. 2+ elbow reflex. All right, now we're gonna check her brachioradialis reflex. All right, we're gonna hold her thumb here. Yep, got that one. Oh. Hit her bone. That wasn't very nice, but I did feel a reflex. It was 2+ normal. All right, we're gonna check her quadriceps. Let your legs dangle. All right. Yep, got it. Oh, got that one too. 2+ reflex on both of those. And then we can do the Achilles reflex. Lay down flat again. All right, bend your like this. And oh, that's for if a person is supine. I'm sorry, the Achilles. We could do this. Oh! Got her bone good that time. I missed it. But I did feel it that time though. When I'm not smacking her on the bone, I got it. All right. And then we're going to check for clonus. I'm going to just do a rapid motion here. And there's no abnormal movement. All right. No tremor or anything in that. All right. All right. And then I'm going to kind of tickle her feet. All right, I got a little more reaction on the right than I did on the left, but both feet moved when we did the plantar reflex. And then the last thing we're going to check is for her abdominal reflex. We actually saw this earlier in the abdominal assessment that she, when you touch her, she would flinch and guard. So that's again, good positive 2+ normal reflex on her abdomen.